Good day, dear students. I am Chimitrov Sergei Nikolaevich, the head of Human Anatomy Department in Samara State Medical University. And today we'll talk about the muscles of the body. Uh, First, we'll talk about the muscles of back. Next, we'll talk about the muscles of chest. And also, we'll talk about abdominal muscles. And the second part of our lecture is the weaknesses of the abdominal wall. So all these parts of our lecture are the questions of the particular myology. So the muscles of the back are divided in two groups, superficial and deep, the bulk of them being formed by autochthonous muscles that originate from the dorsal parts of the trunk myotoms. They are covered by the muscles which are displaced to the back from the head, visceral muscles, and upper limbs, truncapetal muscles. As a result, the muscles of the back they arrange in two layers, the superficial and deep layer. Superficial muscles. These muscles attach to the shoulder girdle and upper arm. The trapezius muscles, which is of branchial origin, move to the trunk from the head and is therefore innervated by the 11th cranial nerve, nervus accessorius. The latissimus muscle of the back, a truncapital muscle, moved to the back from the head and is therefore supplied with nerves from the brachial plexus. The levator muscle of scapula and the rhomboid muscles are truncofugal muscles, which moved from the trunk to the shoulder girdle and are innervated by the short branch of the brachial plexus. Muscles attach to the ribs. The superior and inferior posterior serratus muscles, both are derivates of the ventral trunk musculature which have been displaced to the back. They are innervated by the anterior branch of the spinal nerves, nervi intercostalis. And also we talk about deep muscles. Like the skeleton, the muscles of the actual skeleton are the first to arise in the process of phylogenesis. In man's ontogenesis, they consequently appear first and lie deeper, preserving the primitive metametric structure. According to origin, they are grouped as follows: autochthonous muscles, derived from the dorsal parts of the myotomes and innervated therefore by the dorsal branch of the spinal nerves. Deep muscles of ventral origin, innervated by anterior branches of the spinal nerves. These are the anterior intertransverse muscles of the neck, the lateral intertransverse muscles of the loins, and the levatorous castarum muscles. So first we'll talk detailedly about superficial muscles of the back. And first we'll talk about the muscles attached to the belt of the upper limb. The trapezius muscle, in Latin this is musculus trapezius. You may see this muscle on the left picture. This is triangular muscle keeping the upper part of the back to the occiput. The trapezius muscles together form a trapezium, hence the name. It originates from the spinous processes of the old thoracic vertebra, from the ligamentum nuchae, and from the superior nuchal line to the occipital bone. The upper fibers of the muscle destined to be inserted into the acromial end of the clavicle. The middle fibers pass horizontally to the acromion, and the lower fibers extend laterally to the spinous scapula. In the region of the spinous process of the seventh cervical and the first two thoracic vertebrae, both trapezius muscle form a wide diamond-shaped tendinous area. Action. Contraction of the upper fibers of the muscle elevates the shoulder girdle, the shoulder blade, and clavicle. The inferior angle of the shoulder blade turning laterally, as occurs for instance when the arm is raised above the shoulder. The lower fibers pull the shoulder blade downward. Contraction of the all fibers of the muscle pulls the shoulders to the back. On contraction of both muscles, the shoulder blades are drawn toward each other. Next, we'll talk about latissimus dorsi muscle. You may see this muscle on the right picture, this one. The latissimus dorsi muscle, musculus latissimus dorsi, it's in Latin, occupies the whole lower part of the back, and its upper portion is covered by the low end of the trapezius muscle. The latissimus dorsi originates from the spinous process of the lower four, sometimes 5 or 6 thoracic, of the lumbar and sacral vertebra, from the posterior portion of the iliac crest, and finally 4 of its slits arise from the low foreribs. These slits interdigitate with the posterior slits of the external oblique muscle of the abdomen. You may see on this picture. From the site of their origin, the fibers of the latissimus dorsi muscle pass upward and laterally in converging manner, embrace with their upper edge the inferior angle of the shoulder blade, and approaching the humerus are inserted into the crista tuberculi minoris. Crista tuberculi minoris, it's Latin. Crista tuberculi minoris, it's English. In their initial portion, in the lumbar region, both latissimus dorsi muscles form an extensive aponeurosis. You may see in white, this is aponeurosis, which merges with the thoracolumbar fascia. Action. Contraction of the muscles pull the upper limb to the back and downward, and at the same time rotates it medially. By means of humerus, the muscle moves the shoulder girdle in the same direction. Because it's attached to the ribs, the muscle can expand the chest when the upper limbs are held fast and thus help expiration. It can also pull the trunk up the upper limbs during exercise on a horizontal bar or trapeze. Monkeys swing their body from branch to branch by pulling their trunk upward, moving by means the upper limbs. This causes brachiation, which explains the powerful development of the latissimus dorsi in monkeys and its marked preservation in men. And next we'll talk about rhomboid muscles. You may see these muscles on the right pictures. And also we talk about levator scapular muscle. You may see also on this picture. So there are rhomboid major and minor muscles, musculus rhomboidus major and minor. You may see this one is rhomboidus minor, this is major. So the rhomboid muscles closely adjoin and one another under the trapezius muscle and have the shape of rhomboid plate. They originate from the spinous processes of the lower two cervical and upper 4 thoracic vertebrae. Lesser muscle starts from 2 cervical and greater muscles starts from thoracic vertebra and are inserted into the medial border, you may see on this picture, of the shoulder blade below the spinous scapula. Action. Contraction of the rhomboid muscles pulls the shoulder blade to the spine and upward, being the antagonists of the anterior serratus muscle. Together with it, the rhomboid muscle press the medial border to the shoulder blade firmly to the thoracic edge. Levator scapular muscle. So, musculus levator scapulis in Latin, originates from the transverse processes of the upper four cervical vertebra, passes downward, you may see this muscle here, passes downward and laterally, and is inserted into the superior angle of the shoulder blade. Its action is implied by its name. It's lift scapula. Next, we'll talk about muscles attached to the ribs. And so, there all of them are formed the third layer of the superficial muscles of the back. They have this shape of two thin plates and are called the posterior serratus muscles, musculus serrati posteriores. The serratus posterior superior muscle, musculus serratus posterior superior, you may see this muscle on this picture, lies in the upper part of the back under the rhomboid muscle. It originates from the spinal processes of the lower two cervical and upper two thoracic vertebrae, runs obliquely downward and laterally, and is inserted by first leaps into the posterior surface of the second to fifth ribs, laterally of their ankles. You may see this muscle on this picture. Action raises the ribs. And next you may see the serratus posterior inferiors muscle, musculus serratus posterior inferior. The serratus posterior inferior muscle lies in the same plane as the superior muscle, you may see on this picture, but its fibers run in the opposite direction, originated from the thoracolumbar fascia in the region of the spinal processes of two lower thoracic and upper two lumbar vertebrae. It's inserted by first leaps into the posterior surfaces of the 9th to 12th ribs. So next we'll talk about deep back muscles. All of them are autochthonous muscles. The autochthonous muscles of the back form on each side two longitudinal, lateral and medial muscular tracts, which are lodged in the groove between the vertebral, spinous and transverse processes and the angles of the ribs. In the deep parts nearest to the skeleton, they are made up of short muscles arranged in segments between the vertebrae. This is medial tract. The long muscles are closer to the surface. This is lateral tract. In addition, the splenius muscle covers both tracts in the posterior cervical region. All these muscles have a common origin. They originate from the musculature of the back. Deep muscles of the back, which in the amphibia consist of a series of nerves, beginning with the reptiles. However, only part of the muscles of the back maintain a metametric structure, joining the vertebrae to each other, the muscle of medial tract, while the other parts merge to form the lung muscle, the lateral tract. The splenius capitis and splenius cervicis muscles, musculus splenius capitis and musculus splenius cervicis, it's in Latin, originate from the spinous processes of the lower 5 cervical and upper 6 thoracic vertebrae run upward and laterally, after which the splenius muscle of the head, musculus splenius capitis, is inserted into the lateral half of the superior nuchal line and the mastoid process, while the splenius muscle of the neck is inserted into the transverse process of the second and third cervical vertebrae. In contraction of one muscle, the head turns in its direction. Bilateral contraction bends the head and neck backwards. Next, we'll talk about lateral tract muscles. The lateral tract. The characteristic features of this tract is the attachment of the muscles to the vertebral transverse processes and the ribs or to their rudiments. The sacrospinal muscle, musculus erector spinae, you may see this muscle on this picture and you may read, constitutes the main mass of the autochthonous musculature of the back. It originates from the sacrum, spinous processes of the lumbar vertebra, iliac crest and thoracolumbar fascia, and then extends to the skull and forms 3 divisions according to the insertion. First, into the ribs. This is iliocostalis muscle, musculus iliocostalis, the lateral division of the rectus spinae muscle. It has 3 parts: lumbar, inserted into the transverse process of the upper lumbar vertebra, and the angles of the lower ribs; thoracic, inserted into the angles of the upper ribs, 6th and 5th; and cervicic, inserted into the transverse process of the lower cervical vertebra, its neck part. Next, insertion into the transverse processes. The longissimus muscle, musculus longissimus dorsi, the intermediate division of the rectus spinae. It has 4 parts: lumbar, thoracic, cervicis, and capitis, and is inserted in the transverse processes of all the thoracic and upper cervical vertebrae, also to the ribs, 2nd to 12th, and the mastoid process of temporal bone, musculus longissimus capitis. And also, you may see spinosis muscles, spinalis muscles, musculus spinalis, which insert into the spinous processes. It's inserted into the spinous process of the thoracic from 2nd to 8th and cervical from 2nd to 4th vertebra. So, separate bundles passing between the transverse process of 2 adjacent vertebrae are also related to the lateral tract. They are conspicuous in the most mobile parts of the spine, in the cervical and lumbar. Cervical part calls musculi intertransversarii posteriores. You may see and read this part. And lumbar, musculi intertransversarii medialis, lumborum. You may read this muscle on this picture. So next we'll talk about medial tract. The muscles of this tract lie under the lateral tract and consist of the separate bundles running obliquely from the transverse processes of one vertebra to the spinal processes of the contiguous vertebrae above. Because of this, they are known by the common name of transversospinalis muscles, musculi transversospinalis. You may see these muscles on this picture. They extend from the sacrum to the occipital bone in three layers that are distinguished by their depth and by the number of vertebrae they overlap. The nearer the muscles to the surface, the steeper and longer the course of their fibers, and the greater are the number of vertebrae which they overlap. According to these, the following layers are distinguished. First, superficial layer, musculus semispinalis, whose bundles overlap 5 or 6 vertebrae. Middle layer, musculi multifidi, whose bundles overlap 3 or 4 vertebrae. And deep layer, musculi rotatoris, it's in Latin, passing over 1 vertebra or to the contiguous vertebra. Muscle bundles between spinous processes of contiguous vertebra, muscles interspinalis, musculi interspinalis, also belong to the medial tract. They are well developed only in the most mobile parts of the spine, cervical and lumbar, and are absent in the thoracic region. Their remnant between the sacrum and coccyx is represented by the sacrococcygeus posterior muscle, the most mobile part of the spine in its articulation with the occipital bone. Musculi transversospinalis is particularly well developed and is made up of 4 paired muscles, 2 oblique and 2 straight muscles lying to the back of the atlanto-occipital joint under musculus semispinalis and musculus longissimus. The oblique muscles differ from one another in location and are divided into the superior and inferior muscle. So on this picture you may see superior, this one, and inferior oblique muscles. Musculus obliquus capitis superior, it's in Latin, stretch from the transverse process of the atlas to the inferior nucha line. The obliquus capitis inferior muscle, musculus obliquus capitis inferior, passes from the spinous process of the second cervical vertebra to the transverse process of the first cervical vertebra. You may see this on this picture. The straight muscles are distinguished by their length and are divided into the greater and lesser muscles. You may see these muscles on this picture. Greater and lesser. The greater, rectus capitis posterior major, it's in Latin, passes from the spinous process of the second cervical vertebra to the inferior nuchal line. The lesser, musculus rectus capitis posterior minor, it's in Latin, stretched to the same line from the posterior tubercle of the first cervical vertebra atlas. So these muscles exert their action onto the atlanto-occipital and atlanto-axial joints. Contraction of these muscles on one side contributes to turning of the head to the corresponding side. Bilateral contraction pulls the head backward. All the action. So, the action of the complex of the autochthonous muscles of the back consists in holding the trunk erect. The specific features of their insertion by many bundles into many points on the bones ensure the distribution of the muscle force over the large area. Contraction of all the parts of these muscles on both sides affects general extension of the spine, while contraction of separate parts on one side affects extension between the separate vertebrae. Contraction of these muscles on one side causes lateral flexion of the spine and the trunk together with it to this side. The oblique bundles of the autochthonous muscles, musculi rotatores and multifidi, it's in Latin, accomplish rotation of the spine. The upper parts of the muscles nearest to the skull participate into corresponding places to movements of the head, as pointed out above. The deep muscles of the back also take part in the respiratory excursions. The lower part of the iliocostal muscles lowers the ribs, while its upper part raises them. It should be noted that the rectus spinae muscle contracts not only in extension of the spine, but also in flexion of the trunk to contract the backward pull of gravitational force. Next, we'll talk some words about deep muscles of the back of ventral origin. So, the levatorus castarum, muscles which lifting ribs, levatorus castarum muscles, musculi levatorus castarum. You may see these muscles on this picture. Are muscle bundles of the external intercostal muscles that are displaced toward the spine. They exist only in the thoracic region and are under the rectus spinae muscle. Each bundle originates from a transverse process, starting from the 7th cervical and ending at the 11th thoracic vertebra, and is attached to the contiguous rib below. Besides the short bundles, levatorus castarum brevis muscles, musculus levatorus castarum brevis, in the lower part of the thoracic region are the long bundles, levatorus castarum longi muscles, musculus levatorus castarum longi, overlapping the rib. You may see these muscles on the picture. Despite the name, the action of these muscles as levator of the ribs, or lift ribs, is hardly significant. They mainly participate in lateral bending of the spine. The group of muscles of ventral origin also includes the remnants of the intercostal muscles found as muscle bundles between the costal rudiments, anterior tubercles of the cervical vertebra, anterior intertransverse muscles, musculi intertransversali anteriores cervicis. You may see and read about this muscle on this picture. And lateral intertransverse muscle, musculi intertransversali lateralis lumborum. It's the more mobile parts of our spine, neck or cervical and lumbar. Next, we'll talk some words about fascias. The outer surface of the trapezius and latissimus dorsi muscles is covered with thin superficial fascia, which thickness in the posterior portion, fascia nuchae or nuchal fascia. In addition, there is another fascia on the back which lies deeper and separates the autochthonous musculature of the back from the muscles lying more superficially. It's called the lumbar fascia. You may see this fascia on this picture. Fascia thoracolumbalis, it's in Latin. And two layers are distinguished in it, the superficial or posterior layer and the deep or anterior layers. You may see these layers too. The superficial layer stretches from the pelvis to the head. Its upper part in the region of the posterior serratus muscle is thin, but its lower part is very strong, whereas continuous with the aponeurosis of the latissimus dorsi muscle. Medially it's attached to the spinal process, laterally it's continuous with the ribs. The deep layer of the lumbar fascia originates from the transverse process of the lumbar vertebra and stretch on the between the 12th rib and the iliac crest, and it's attached to them above and below. Running laterally, the deep layer covers the anterior surface of the rectus spinae and on the lateral border of this muscle marks with the superficial layer. The deep autochthonous muscles are thus invested in a closed osteofibrosis sheath with the initial portion of the rectus spinae being enclosed in the fibrous sheath. And also you can see this thoracolumbar fascia of this picture. And also you may see the originate part of latissimus dorsi muscle. So next we'll talk about ventral muscles. Um, so the ventral musculature of lowest vertebrates stretch uninterruptedly on the abdominal surface of the body. In the higher vertebrates, it's differentiated into four regions: cervical, thoracic, abdominal, and caudal. In man, the abdominal musculature is particularly developed because of his erect. The ventral musculature is represented on the neck by muscles attached to the hyoid bone, and the scalene and the prevertebral muscles, in the thoracic region by the intercostal muscles, the transverse muscle of the thorax and the diaphragm, and in abdominal region by the oblique transverse straight muscles of the abdomen and the quadrate muscle of the lions. In the caudal region, the ventral musculature is reduced as a result of reduction of the tail. The trunk autochthonous musculature derived from the ventral pulses of the myotomes is monotypical in structure of the hoof despite the differentiation according to region. And the fully developed ventral musculature, the lateral part, usually made up of three layers, is distinguished first of all. The medial part, the straight muscle, is seen next. In our lecture, is stretched longitudinally from the pelvis to the head. On each side of the connective tissue medial septum, linea alba, you may see this line on this picture. In men, this type of musculature is most conspicuous in the region of the abdomen where the broad lateral, the oblique and transverse abdominal muscles and the straight middle, the rectus abdominis musculature is well developed. The anterior straight muscles are absent in the thoracic region because of the presence of the sternum, but they are again encountered on the neck, muscles attached to the hyoid bone. The lateral musculature is unsegmented in the abdominal region, but has retained distinct primary merism in the thoracic region. owing to the presence of the ribs along the myocepta and myotomes intercostal muscles. On the neck, the lateral musculature has transformed into three scalene muscles. We will talk about this muscle when we will talk about head and neck on next lecture. As pointed out above, signs of metamerism, tendinous intersection, persist also in the straight musculature. In addition, some areas of the ventral musculature are displaced to the anterior surface of the spine, prevertebral muscles, or to both sides of it, quadrate muscle of lines, or even straight over the dorsal surface of the spine, becoming part of the musculature of the back. The prevertebral muscles are developed in the cranial end of the trunk or on the neck. Similar muscles on the caudal end in men serve for the formation of the muscular floor of the pelvis, the levator ani muscles, and we will talk about this muscle in chapter splachnology. The ventral muscles include still another muscle peculiar to mammals. This is the diaphragm, a derivative of the cervical muscles, which distending to the lower end of the thoracic cage to the border with the abdominal cavity. Finally, newcomer muscles derivative of the visceral arch, and some of the limb muscles lie over the autochthonous ventral musculature in places. So, first we'll talk about muscles of the chest. And first we'll talk about the upper extremity chest muscles. The musculature of the chest is divided into the muscles that originate from the surface of the thoracic cage and stretch from it to the shoulder girdle and upper limb, and the muscles proper autochthonous of the chest, which are components of the thoracic wall. Chest muscles related to the upper limb. They are musculus pectoralis major, pectoralis major muscle. You may see this muscle on this picture. And also you may see the pectoralis minor muscle, number 2, on this picture. So all these two muscles, musculus pectoralis major and musculus pectoralis minor, are truncapital muscle. Also, we will talk about subclavius muscle. You may see this muscle on this picture, number 6, and serratus anterior muscle. Particularly, you may see this muscle in number 5 on this picture. All these two muscles, subclavius and serratus anterior, are truncafugal muscle. So, the pectoralis major muscle, musculus pectoralis major, originates from the middle half of the clavicle, pars clavicularis, the anterior surface of the sternum and cartilage of the 2nd to 7th ribs, pars sternocaustalis it's in Latin, and finally from the anterior wall of the sheath of the rectus abdominis muscle, pars abdominalis. The fibers of the muscle stretch laterally where they converge and are attached by a short tendon to the crista tuberculi majoris of humerus. The lateral border of the muscle joins the border of the deltoid muscle. You may see deltoid muscle here too. So it's separated from it by a small groove which called sulcus deltoide pectoralis, it's in Latin, which widens upward under the clavicle to form a small infraclavicular fossa. You may see this fossa here. under clavicle. Action. This muscle, musculus pectoralis major, draws the arms to the trunk and rotates it medially, pronation. The pars clavicularis lifts the arm forward. The muscle can raise the ribs with the sternum, where the upper limbs are held fast, and in this way help inspiration. It's very important, inspiration. The pectoralis minor muscle, musculus pectoralis minor, you may read on this picture and you may see number 2, is under a greater pectoral muscle. It originates from the 2nd to 5th ribs. You may see these ribs. By means of 4 slits and is inserted into the coracoid process of the scapula. Action. On contraction, this muscle pulls the shoulder blade forward and downward. When the arms are held fast, it acts muscle of inspiration. Next we'll talk about subclavius muscle. It's very small and stretches from the clavicle to first rib. The muscle strengthens the sternoclavicular articulation by pulling the clavicle down and medially. And next we'll talk some words about serratus anterior muscle. Musculus serratus anterior, it's in Latin, is the surface of the lateral chest wall. It usually arises by 9 slits from the 9 upper ribs and is attached to the middle border of the scapula. The inferior slits interdigitate with the initial slits of the external oblique muscle of the abdomen, found on the lateral surface of the thoracic cage. And we will see these interdigitate slits when we study abdominal wall. Together with the rhomboid muscle, which is also attached to the middle border to the scapula, it forms a wide muscular loop embracing the trunk and pressing the scapula to it. Contraction of the whole anterior serratus muscle simultaneously with the muscles of the back, the rhomboid and trapezius muscle, immobilize the scapula by pulling it forward. The lower end of the muscle rotates anteriorly and laterally the inferior angle of the scapula, as occurs in lifting the limb above the shoulder. The superior slits move the scapula together with the clavicle forward and acts as antagonists of the middle fibers of the trapezius muscle. So next we'll talk about deep muscles of the chest. The external intercostal muscles, musculi intercostalis externi, through the intercostal spaces from the spine to the costal cartilage. You may see this muscle of this picture. They originate from the inferior border of each rib, descend posterior anteriorly, and attach to the superior border of the continuous rib above between the costal cartilage. The muscles are replaced by a fibrous band with fibers lying in the same direction. Membrana intercostalis externi. You may see this membrane in white color. So next, the internal intercostal muscles, musculi intercostalis interni, are under the external muscles, and the direction of their fibers is opposite to that of the fibers of the latter, which they intersect at an angle. Originated From the superior border of the contiguous rib below, they extend anteriorly and attach to the contiguous rib above. In contrast to the external muscles, the internal intercostal muscles stretch between the costal cartilage and reach the sternum. Posteriorly, the internal intercostal muscles reach under the costal angles and are further replaced by the posterior intercostal membrane, membrana intercostalis posterior, stretching between the posterior ends of the ribs. So you may see a part of internal intercostal muscles here. The subcostal muscles, musculus subcostalis, are thin muscular bundles found on the inner surface of the lower part of the thoracic cage in the region of the costal angles. Their fibers are directed like the fibers of internal intercostal muscles, but the muscles overlap one or two ribs. So next we'll talk about transverse muscle of the chest, musculus transversus thoracis. You may see this muscle on this picture. So also you may see the subcostal muscles on the left picture here. So the transversal thoracic muscle, musculus transversus thoracis, is also on the inner surface of the thoracic cage, on its anterior surface. If we look behind the sternum bone, we will see this muscle. So, is continuation of the transverse muscle of abdomen. You may see the transverse muscle of abdomen here. Action. The external costal muscles raise the ribs and expand the thoracic cage in anterior, posterior, and transverse direction, and are muscles of inspiration during normal quiet breathing. Other muscles also take part in forced respiration. These are muscles capable of raising the ribs, the scalene sternocleidomastoid, the major and minor pectoral muscles, etc., provided the mobile points of their attachments into the other places are held firmly fixed, as occurs, for instance, instinctively in patients suffering from dysmenorrhea. It's very important. Diminution in the capacity of the thorax in expiration is mainly due to the elasticity of the lungs and the thoracic cage itself. Some authors claim that the internal intercostal muscles also contribute to quiet expiration. The subcostal muscles, the transverse muscle of the thorax, and other muscles which draw the ribs downward, the abdominal muscles, also act in first expiration. Next, we'll talk about fascias. The anterior surface of the pectoralis major muscles is covered by the superficial sheet of the pectoral fascia. You may see this fascia on this picture, which is continuous medially with the sternal periosteum, superiorly with the clavicular periosteum, and laterally with the deltoid fascia. You may see deltoid fascia here. In females, this sheet separates the muscle from the mammary gland. Under the pectoralis major muscle is the more conspicuous deep sheet of the pectoral fascia. It's thickest in the region of the claviopectoral triangle and is known here as a claviopectoral fascia, fascia claviopectoralis. You may see this part of fascia here and here on this picture. Separating and then rejoining the deep sheet of the pectoral fascia enclose the subclavius and lesser pectoral muscle. You may see lesser pectoral muscle, and in blue you may see this fascia. So both sheets of the pectoral fascia join in two places in the deltoidal pectoral sulcus at the inferior border of the greater pectoral muscle, where the pectoral fascia is continuous with the axillary fascia. Fascia axillaris is situated here in fossa axillaris. This fascia forms the floor of the axillary fossa. From the periphery of the fossa, it spreads to the adjustment of muscles, while in the center it forms a depression with the overlying skin, as the result of which the axilla or armpit is formed. Besides the fascia covering the external surface of the thoracic cage, here is the endothoracic fascia, fascia endothoracica, which lines its inner surface and also passes over to diaphragm as a very thin layer of fat. And you may see part of this endothoracic fascia here behind the ribs. So next we will talk about diaphragm. Diaphragm forms the partition between the thoracic and abdominal cavities. It's a flat, thin, dome-shaped muscle covered above and below with fascia and serous membranes. The muscle fibers arise from the whole circumference of the inferior thoracic aperture, run upwards, and are contiguous with an aponeurotic tendon occupying the center of diaphragm and called the central tendon, centrum tendineum. You may see this centrum in white here on this picture. According to the origin of the fibers, the lumbar, costal, and sternal parts. You may see all these three parts here. This is sternal, this is costal, and this is lumbar part with crurus. So lumbar, costal, and sternal parts are distinguished in the muscular part of the diaphragm. And I show you these parts. The lumbar part, pars lumbalis, you may see this part of this picture. Here's it. Is the strongest part and consists of two crura, right and left. Crus dextrum et sinistrum, it's in Latin. Both crura originate by means of a long tendon from the anterior surface of the bodies of the first to fourth lumbar vertebra, and left crus arise from two tendinous ligaments are arise from two lumbar vertebrae. So also two tendinous ligaments, you may see these ligaments here in white, are thickenings of the thoracolumbar fascia. One of these ligaments, the medial, in 24, medial arcuate ligament, ligamentum arcuatum mediale, passes above the psoas major muscle. You may see this muscle, and stretch between the body of the first or second lumbar vertebra and its transverse process. The second, lateral arcuate ligament, you may see in 25, this one, ligamentum arcuatum laterale, it's in Latin, runs above the quadrate muscle of the legs. From the transfer process of the first lumbar vertebra to the free border of 12th rib. 12th rib. A triangular space, hiatus aorticus, you may see it here, is left between both crura and the spine. It transmits the aorta and the thoracic duct, a lymphatic duct, stretching behind it. The edge of this opening is bordered with a tendinous band, as a result of which contraction of the diaphragm does not affect the lumen of the aorta. Ascending, the crura converge in front of the aortic hiatus. You may see this converge here. But somewhat to the left and above it they separate again to form an opening, the esophageal hiatus, hiatus esophageus, through which the esophagus and both vagus nerves attendant to it passes. The esophageal hiatus is bordered with muscle bundles which act as a sphincter regulating to the movement of food. Narrow openings form between the muscle bundles of each cruise. They transmit the splanchnic nerves, the azygous vein, and sympathetic trunk. The costal part, pars costalis, originate by separate slips from the inner surface of cartilage of the 7th to 12th ribs. These slips interdigitate with the initial slips of the transversus abdominis muscles and extend carrying toward the tendinous center. And next we talk about sternal part, pars sternalis. This is the smallest of all the parts of the diaphragm. Is made up of several short slips arising from the posterior surface of the sternal xiphoid process and stretching to the tendinous center. A paired triangular opening, you may see this in 35. The sternocostal triangle, trigonum sternocostale, is left between the sternal part and the costal part of the diaphragm near the sternum. The internal thoracic artery, superior epigastric artery, passes in it. Another larger paired space, the lumbar costal triangle, lies between the costal and lumbar parts. It corresponds to the communication existing between the thoracic and abdominal cavities in embryonal life. It's covered by the pleura and endothoracic fascia above and by the subperitoneal fascia, retroperitoneal fat, and peritoneum below. Diaphragmatic hernias may protrude through it. The posterior surface of the kidneys and adrenal enclosed in fatty capsule are contiguous to the lumbar costal triangle. The central tendon of the diaphragm, centrum tendineum, has trifoliate shape. You may see on this picture. Its surface shines like a mirror, and it was formerly called Helmont mirror or speculum. A little to the back and to the right of the middle, its quadrangular opening on the central tendon, foramen vena cava inferior, you may see in blue, which transmits the biggest vena, inferior vena cava. As pointed out above, the diaphragm is dome-shaped, but it's asymmetrical in height. Its right part abutting entirely on the voluminous liver, stands higher than the left part. So, the action of diaphragm. During inspiration, the diaphragm contracts, its dome flattens out, and its height decreases. With the descent of the diaphragm, the thoracic cavity grows larger in the vertical direction, which is what occurs during inspiration. So let's see again. You may see the weaknesses of diaphragm. These are trigonum lumbocostale, and these are trigonum sternocostale. And also the most weakness of diaphragm is hiatus esophageus. You may see on this picture. And so you may see the developmental defects of diaphragm. You may see these defects. First is frena pericardial, anterolaterally defect of development. Also, you may see central, number 3, posterior lateral, number 4. Also, you may see the aplasia of diaphragm, lateral opposite aplasia. And also, you may see diaphragmatic hernia. You may see the hernia in aplastic parts of diaphragm here, and you may see the internal abdominal organs and in chest cavity, in thorax cavity. It's abnormal. And also you may see the esophageal hernias. You may see on this picture, and also you may see on these pictures diaphragm hernias. And I repeat that the most weaknesses place in diaphragm is hiatus esophageus, esophagus hiatus. So, next we'll talk about abdominal muscles. The muscles of abdomen occupy the space between the inferior circumference of the thoracic cage and the superior border of the pelvis. They surround the abdominal cavity and form its walls. The lateral muscles, the external oblique muscle, musculus obliquus externus abdominis is in Latin, the internal oblique muscle, musculus obliquus internus abdominis, and the transversus abdominis muscle, musculus transversus abdominis. So next, anterior muscles, the rectus muscles, and pyramidalis muscle. And also you must know posterior muscles, quadratus lumborum muscle. The abdominal muscles are exclusively related to the autochthonous ventral musculature of this region and are innervated by the intercostal nerves and superior branches of the lumbar plexus. So, the lateral muscles, you may read again external, internal abdominal, and transverse abdominal muscle. These are three broad muscular sheets, one overlapping the other. Their tendinous epinephrosis, after forming the sheath of rectus abdominis muscle, join on the anterior aspect of the abdomen at the linea alba. You may see on this picture the external oblique muscle, musculus obliquus externus abdominis, the outermost of the three broad abdominal muscles. It arises from the lower eight ribs, but each sleeps on the lateral surface of the thoracic cage. The muscular fibers run downward and forward. The white surface at the origin of the muscle and the localization that's lower and more caudal than in quadrupeds are due to the increase in the strength of the upper limb musculature, which in anthropomorphic apes serves as a means for swimming the body from tree to tree, brachiation, while in humans it's the organ of labor. The need for greater support for the muscles of the upper limbs causes broadening and elongation of the thoracic cage and caudal displacement of the abdominal muscles attached to it, namely the oblique and rectus abdominis muscles. The fibers of the external oblique muscle act in continuation of the external intercostal muscle and pass the same direction. You may see this muscle and external intercostal muscle here and external abdominal muscle. Obliquely downward and forward. This is explained by the gradual disappearance of the ribs in the process of phylogenesis, which caused the intercostal muscles to fuse and form continuous muscular sheaths. The posterior sleeves are inserted into the iliac crest. The other fibers of the muscle are continuous with extensive aponeurosis, which passes in front of a rectus muscle. You may see a part of this aponeurosis here. So it passes in front of the rectus muscle and joins the contralateral aponeurosis on the midline along the linea alba. The free inferior border of the aponeurosis of the external oblique muscles spans the gap between the anterior superior iliac spine, folding back on itself to form a groove. The border, artificially separate from the rest of the aponeurosis, is called inguinal ligament, ligamentum inguinale. You may see the part of this ligament here. In primates, the inguinal ligament supports the lower abdominal wall and the inguinal canal, and it's important for erection. In humans, it's simply distinguished as the inferior wall or floor of the inguinal canal. At the medial attachment of the inguinal ligament, its fibers pass backward to the pubic crest and form the lacunar ligament. Above the medial part of the lingual ligament, in the aponeurosis of the external oblique muscle, is triangle cleft the superficial ring of the inguinal canal. You may see this small ring here, inguinal canal. Annulus inguinalis superficialis is in Latin. It's discussed in detail below. To the back of the posterior border of the fleshy part of the external oblique muscle, between it and the origin of the latissimus dorsi muscle, is a small triangular space, the lumbar or petit triangle. I will talk about this triangle later. So, the outer surface of the external oblique muscle is covered by a thin sheet of fascia extended over the aponeurosis, the muscle, and closely fusing with it. Another superficial fascia, one related to the deep layer of the subcutaneous tissue, is found over this sheet, in the hypogastric region. Inferiorly, it fuses with the inguinal ligament. The internal oblique muscle of abdomen, musculus obliquus internus abdominis, is found under the external oblique muscle. It arises posteriorly from the thoracolumbar fascia, then from the iliac crest, and from the lateral two-thirds of inguinal ligament. Its fibers run on the whole upward, or to be more precise, they fan out. The posterior muscular bundles extend to attach to the inferior margins of the 12th, 11th, and 10th ribs, the internal intercostal muscles, and their extensions between the ribs. The interior bundles of the muscles are continuous with a broad aponeurosis, which on the lateral border of the rectus abdominis muscle splits into layers contributing to the formation of the sheath of the muscle. The aponeurosis meets the contralateral aponeurosis medially to the rectus muscle of the linea alba. On the outer and inner surfaces, the internal oblique muscle is covered with fascial lamina. So you may see the part of internal oblique muscle here, and here it's cutting here. And next we'll talk about the transversus abdominis muscle. Musculus transversus abdominis is the deepest and thinnest of the broad of the abdominal muscles. It arises from the inner surface of the lower 6 ribs. Above the diaphragm, it extends as the transverse muscle of the thorax. Inferiorly and posteriorly, the muscle originates from the deep layer of the thoracolumbar fascia, and finally its lowest part arises from the iliac crest and the lateral two-thirds of inguinal ligament. You may see the transverse abdominis muscle here. So, from the sides of the origin, the fibers of the muscle run horizontally. You may see this direction. So, it runs horizontally forward and medially and end in a white aponeurosis. You may see in white this aponeurosis, which passes to linea alba. You may see also this linea liner behind the rectus abdominis in the upper part and in front of this muscle in the lower part. You may see this part in front of this rectus muscle. The many mammals, this muscle is strongly developed and can pull the testes from the scrotum into the body cavity. In human beings, the internal oblique and the transversus abdominis muscles give rise to only a small muscular bundle, a rudimentary muscle rising the testis, musculus cremaster. On the inner surface facing the abdominal cavity, the transversus abdominis is covered with the fascia transversalis, which is part of the common subperitoneal fascia, fascia subperitonealis. The latter lines the whole inner surface of the abdominal walls and in places is named according to the localization fascia transversalis, fascia iliaca, fascia pelvis. So next we'll talk about anterior muscles. You may see two these muscles here, little pyramidalis muscle, inconstant muscle, and also you may see the rectus muscle. So the rectus abdominis muscle stretch on both sides lateral of the midline and consists of the longitudinal muscle bundles running vertically. It arises from the anterior surface of the 5th, 6th, and 7th costal cartilage and from the xiphoid process, sternum, and becoming gradually narrower, stretched downward and attached by a strong tendon to the pubic bone between the symphysis and the pubic tubercle. In men, the rectus abdominis muscle originates at a lower level than in animals. This is explained by the broadening of the chest in anthropoid apes and human beings. Along its length, the muscle is interrupted by transverse, 3 or 4, you may see, tendinous intersections. Intersectiones tendinates in Latin, you may see in white here, which fuse with the anterior wall of the sheath in which the rectus abdominis is enclosed. The tendinous intersection are traces of the former segmental development of the ventral musculature. They also possess functional significance by separating the muscle in 2 segments. They allow each muscle segment to contract independently. This process, however, demands special training. So the pyramidalis muscle, musculus pyramidalis is in Latin, is a small triangular muscle under the anterior wall of the sheath and the rectus abdominis. Above the symphysis pubis, it's attached to the linea alba, which is tensed on contraction. This is a rudiment of the muscle that in monotremes and marsupials surrounds the pouch in which they carry their young, like kangaroo. Each rectus abdominis muscle is enclosed in the sheath, you may see in white, and also you may see on this picture, this sheath of vagina musculi recti abdominis, formed by the aponeurosis of three lateral abdominal muscles. The upper part above the umbilicus, you may see this one, this upper though. So in the upper part above the umbilicus, the sheath is so formed that the aponeurosis of external oblique muscle passes in front of the rectus muscle, while the aponeurosis of transverse muscle passes behind it. So the aponeurosis of the internal oblique muscle splits. You may see it here. So it splits in 2 lamina, which encompass the rectus muscle anteriorly and posteriorly, fused with the aponeurosis of the external oblique and transverse muscles, and with them form the anterior and posterior walls of the sheath. In the lower part, maybe 4 or 5 centimeters below the umbilicus, the structure of the sheath is different. You may see on low picture. The aponeurosis of the 3 abdominal muscles pass in front of the rectus muscle. You may see on this picture. And form the anterior wall of its sheath, while the posterior wall, you may see here, is replaced by fascia transversalis that lines the inner surface of the abdominal wall. The posterior aponeurotic wall of the sheath terminates here. You may see the terminus line. And as a rather sharp crescentic margin called the arcuate lane, like arch, arcuate lane. The absence of posterior wall of the sheath facilitates the filling of the urinary bladder, which on rising above the edge of the symphysis pubic is displaced on this side. The thickening of the anterior wall of the lower part of the sheath is associated with the upright position of the human body, in which the lower part of the abdominal wall experiences the most pressure. So next we talk about linea alba. The aponeurosis of the broad muscles of the abdomen meet and fuse on the midline and form tendinous band, linea alba, between the rectus abdominis muscles. You may see this linea alba between rectus abdominis muscles. This line stretches from the sternoxiphoid process to the symphysis pubica. It's quite wide in the upper part, 2.5 centimeters at the level of the umbilicus. You may see here the wideness of the linea alba, narrows quickly and some distance below the umbilicus, and to compensate thickens in the anteposterior direction. Almost in the middle of the linea alba is the umbilical ring, annulus umbilicalis, filled with the cicatricial tissue, which fuses with the skin of the umbilicus. The light color of the linea alba is due to the decussation of the tendinous fibers in the frontal plane and sagittal plane, and its poverty of vessels. So surgeons make use of this circumstance when the abdominal cavity must be opened widely during operation. So the action of the abdominal muscles. The muscles of the abdominal narrow the abdominal cavity and exert pressure on the viscera enclosed in it, thus forming the abdominal press, prelum abdominale, whose action is manifested in expelling the contents of the abdominal organs in defecation, micturition, and labor, as well as coughing and vomiting. The diaphragm also takes part in the action. It contracts in deep inspiration, and its flattened part presses downward on the abdominal viscera, which are supported by the pelvic diaphragm. The tonus of the prelum-adrenal muscles keeps the viscera in position, while the muscular aponeurotic wall of the abdomen acts as a support for the abdominal girdle. The abdominal muscles also flex the spine and trunk forward and are antagonists of the muscles that extend the spine. Flexion is accomplished by the rectus abdominis muscle, which brings the chest and pelvis closer together, as well as by the oblique muscles in bilateral contraction. In unilateral contraction, the abdominal muscles and the rectus spine muscle bend the trunk laterally. The oblique muscle of the abdomen take part in rotating the spine with the chest. The internal oblique muscle contracts on the side to which the trunk is rotated, while the external oblique muscle contracts on the contralateral side. Finally, the abdominal muscles also assist in respiratory excursions. Since they are attached to the ribs, they pull them downward and help in expiration. Their participation in this act consists also in exerting pressure on the viscera and thus raising the relaxed diaphragm to the position in hold in expiration. The posterior muscles. The posterior muscles. The quadrate muscle of the lines, musculus quadratus lumborum, is quadrangular, you may see on this picture, muscular plate located in front of erector spinal muscle and separated from it by a deep layer of the thoracolumbar fascia. It arises from the iliac crest and iliolumbar ligament and is attached to the 12th rib as the transfer process of the first to fourth lumbar vertebra. A unilateral contraction with the other abdominal muscles and the rectus spinal muscle, the quadratus lumborum muscle flexes the spine and the chest laterally. In bilateral tonic contraction with the same muscle, it holds the spine in a vertical position. It can also act as a respiratory muscle by drawing the 12th rib downward. And also you may see this quadratum lumborum muscle as a part of posterior abdominal wall. So next we'll talk about inguinal canal. The inguinal canal you may see on this picture, canalis inguinalis, is a passage transmitting the spermatic cord, funiculus spermatic, in the male and the round ligament of the uterus in female. You may see spermatic cord here. The inguinal canal is located in the lower part of the abdominal wall on each side of the abdomen immediately above pupart ligament and descends medially and forward. The canal is 4, maybe 5 cm long. It forms as follows. The internal oblique and transverse abdominis muscle, you may see the borders of this muscle on this picture, are fused with the lateral 2/3 of the groove of the inguinal ligament laterally and pass freely over the spermatic cord. You may see these three borders of these two muscles, internal oblique and transverse muscles here. Thus, a triangular or oval passage forms between inferior border of the internal oblique and the transverse muscles above and the middle part of the inguinal ligament below. This passage is the inguinal canal. The inferior border of the internal oblique and transverse muscles overhanging the spermatic cord gives rise to a bundle of muscle fibers which accompanies the cord into the scrotum. This is the cremaster muscle, the muscle raising the testes. The inguinal canal is closed entirely by the aponeurosis of the external oblique muscle of abdomen. You may see this wall, anterior wall of inguinal canal. It continues below with the inguinal ligament posteriorly. It's closed by transversalis fascia. You may see the transversalis fascia as posterior wall of inguinal canal. The anterior wall is formed by aponeurosis, as I told you, of the external oblique muscle, and posterior wall by the transversalis fascia. The superior wall or root is formed by inferior border of the internal oblique and transverse muscles, and the inferior wall or floor is formed by the inguinal ligament. The anterior and posterior walls each have an opening called the inguinal ring, the superficial ring and the deep ring respectively. The inguinal canal transmits the spermatic cord from the scrotum into the abdominal cavity, since a deep inguinal ring is found laterally to the back and a little above the superficial ring. The inguinal canal stretches obliquely, as mentioned above, forward, downward, and medially. You may see the internal and external rings of inguinal canal. The superficial inguinal ring annulus inguinalis superficialis is in Latin, is formed by the separation of the fibers of the preneurosis of external oblique muscle in two crura, one of which crus lateralis is attached to the tuberculum pubicum, and the other crus mediale to the symphysis pubis. Beside these two crura, a third posterior crus of the superficial ring is described, located within the inguinal canal itself behind the spermatic cord. This crus is formed by the inferior fibers of the preneurosis of the contralateral external oblique muscle. These fibers cross the midline, pass behind the crus media, and fuse with the fibers of inguinal ligament. The superficial inguinal ring, demarcated by the medial and lateral crura, its oblique triangular slit. The sharp lateral angle of the slit is rounded by arched tendinous fibers, fibra intercruralis, originated from the fascia that covers the external oblique muscle. This fascia also distends from the edge to the superficial inguinal ring into the spermatic cord as thin film and accompanies to cord into the scrotum and fascia cremasterica. The deep inguinal ring, annulus inguinalis profundus, the posterior wall of the inguinal canal formed by the fascia transversalis, extending from the margins of the ring to the spermatic cord and form a membrane, fascia spermatica interna, it's Latin, which encloses the cord together with the testes. The medial margin of the deep inguinal ring is strengthened by the bundle of arch-shaped fibers, the interfoveolar ligament. In addition, the posterior wall of the inguinal canal is reinforced in the middle part by tendinous fibers arising from the aponeurosis of the transversus abdominis muscle and distending along the border of the rectus abdominis to the inguinal ligament. This is inguinal phallus. Between these two strengthened areas is the weaker part of the posterior wall of the inguinal channel. The peritoneum covering these walls form two inguinal fossa. You may see peritoneum here, separated from each other by two vertical folds of the peritoneum called umbilical folds. These are follows lateral fold, plica umbilicalis lateralis, a fold of peritoneum elevated by the underlying inferior epigastric artery, a medial fold, plica umbilicalis medialis, containing the medial umbilical ligament, obliterated umbilical artery of the embryo, at a median fold covering the median umbilical ligament, the obliterated urachus in embryo. The lateral inguinal fossa, located laterally here, corresponds to the deep inguinal ring. The medial fossa here, located between the lateral and medial umbilical folds, corresponds to the weaker part of the posterior wall of the inguinal canal and is situated exactly opposite the superficial inguinal ring. Inguinal hernia may emerge, you may see inguinal hernia, emerge into the inguinal canal through the fossa described and formed at protrusion of the abdominal wall. You may see intestinal parts in this protrusion here. A lateral external oblique inguinal hernia protrudes through the lateral fossa, like this, of this picture. A medial internal direct hernia emerges through the medial fossa, from here. The origin of inguinal canals is linked with the descent of the testes distensus testis, and the formation of the peritoneal processus vaginalis in embryonic life. The fossa nearest the midline, the supravesical fossa, situated between the middle and median umbilical folds. So let's look at the hernias and weaknesses of abdominal wall. You may see inguinal canal hernias, uh, oblique inguinal hernias, and also you may see the hernia of this man. And also you may see umbilical hernia in umbilical ring. And also you may see the hernia of linea alba. The linea alba is weaknesses of anterior abdominal wall, and also you may see the hernias protrudes through this linea alba. And also I want to show you the posterior wall and weaknesses of posterior wall. You may see two parts. I talked about them earlier. So you may see two continuous parts of weaknesses in posterior wall. First internal part of weakness is a Lesgev-Grunfeld rhombus. You may see the borders of this rhombus. Superior medial border is musculus serratus posterior inferior. Medial border is musculus rectus spina. Lateral inferior border is musculus obliquus internus abdominis, and lateral superior border is 12th rib. And also you may see the external part of weakness in posterior wall. This is lumbar triangle or T triangle, and you may see three borders of this triangle. You may see the lateral border is musculus obliquus externus abdominis. You may see superior medial border, musculus latissimus dorsi, and you may see the inferior border, this is iliac crest. So you may see the lumbar hernia. You may see the protrusion of this wall in these weaknesses of posterior wall. So I finished my lecture. Thank you for your attention. Goodbye.